Hello, I'm Dr. Hughes. In this video, I'm going to talk about the career counseling process. So my goal with this video, and then I just recorded the Seeing Your Clients as Workers video, my goal is really to try and help you, those of you who are doing clinical mental health, put everything together. How does career counseling fit? Because again, that's the push in the career counseling side of the world. The upcoming NCDA conference, that's even the theme is those connections between career and mental health. All right, so move my picture. All right, so first, I like this chart here that talks about how these all fit together. It's a little Venn diagram, right? So we've got career development and career counseling, which are the same but different. So I'll talk more about those in just a second. Those of you who are doing more like typical, I have no idea, typical mental health are probably going to be doing more career counseling, maybe, depending on your setting. But we'll talk more about career development and how that might fit in as well. And then personal counseling, you're going to see a lot of overlap again with career and personal counseling, and potentially with career development, where again, depending on the age group you might be working with, that's something that I always think about when I'm thinking about the difference between career development and career counseling. Career development is going to be more psychoeducational and more generalized to the age. Think like general development, right? Like when you're working with someone, we always have, again, because we're counselors and we have that development focus, just like we have the wellness focus. But when we're working with someone, it's like, okay, what is typically going on with this person at this age, right? Career is one of those areas that you want to kind of have in your head, okay? And so if you're working with an adolescent, career exploration, according to Super's theory, is what they, might be doing. We also see some delays, however, and so individuals who maybe struggled with substance use when they were in high school age, individuals who maybe were struggling with sexual orientation or gender identity or any of these other kind of big identity tasks that take up a lot of brain space. We might see delays in their career development. And so you may be working with someone who's older, but you may find that that's the big task for them. Their career stuff is the big task for them because they didn't do that when they should have, right? Whenever people typically may, if development is going how we might want it to. We're also going to see a lot of this with people who are growing up in poverty, low SES, where, again, survival needs maybe are the focus. Trauma is going to make a big impact. And so as you're working with individuals to resolve maybe some of these bigger issues, you might find that there's a need to shift to more future thinking, to a more future orientation in order to help them move on, right? And that's where I think the career piece really fits in with some of these bigger issues. Substance use, I see this as being a very good fit. Trauma, right? Whereas people are starting to heal and starting to, again, be in a better space in their lives, we want to help support them in that transition. And oftentimes that career piece is part of that. And so this chart here, again, I really liked because it speaks to the difference between career counseling and career development. Okay, so school counseling background, something I'm very familiar with. We talk a lot about career stuff on the school side of things, and we should be talking about it more on the mental health side, I think. But this first line here, driven by, okay? So career counseling is typically driven by client needs. What issue is your client presenting with? And how might you address it from the career side of things, okay? Whereas career development is going to be more focused on competencies, or maybe at the career development theory level. Okay. So in terms of competencies, we're going to see this a lot in the schools. So K-12, if you're a school counselor, if you're working in colleges, you're going to see a large focus on career development and again, what those tasks might be for that age of individual. And so you're going to be, again, kind of thinking big picture, where should this person be right now? So what are the things that we might be working with them on? And that lends to the difference in the type of service. So career counseling is going to be more responsive to the client, right? So the client has this particular goal or this particular issue, and so our services may be more career focused, or we may have a goal and an intervention aligned with the career side of things to meet that client's needs. Whereas, again, career development is focused bigger picture on career development, and it's going to be exclusively psychoed. With career stuff, even if you're working at the individual level, even if you're doing career counseling, you might see very often some psychoed going on. Okay, and that's absolutely fine, where you might feel like you're talking more, but that should not be just it. Okay, so career counseling is not exclusively psychoeducational, right? The focus, as such, the focus with career counseling, you're going to see an interconnection between career and personal. It's going to just be normal counseling if you're doing this as a mental health counselor, where you may, again, just really focus on that interconnection between work and the person's lives. Whereas, again, from the career development side, you're going to focus on the needs. Likely based on one of the stage theories, because when we're working with, again, where you're seeing a lot of the career development stuff is in the schools, and the stage theories, Super's theory really gives us an idea of what we might be doing with kids when it comes to careers, because they do have career needs. They just aren't going to be able to vocalize them as specifically as an adult can. And so when we're working with kids on this area of their life, that's where we're utilizing the stage theories to help us conceptualize what we might be doing with them. The providers, if you're doing mental health counseling, you're going to be a licensed counselor. If you're focused more on career development, it may vary. You may be a counselor who's offering these services. It could be other staff members. It could be, peers. You might see other career services professionals offering these services. Modalities, typically if you're doing career counseling, is going to be, again, at the more individual level or the small group level, whereas career development, it may very well be at the individual level, but very often you're going to see it at the small or large group level or even the classroom level. Again, in the schools, colleges, maybe community centers where we're offering these services for groups of individuals. And then the format, if you're doing a lot of career counseling, is really, it may be a single session. I think a lot of places are set up to be single sessions where you're coming in, the person's coming in with, again, a very specific need. You're doing some psychoed and you're helping point them in the right direction. However, it might be multiple sessions and or it might be intertwined in the mental health area. And so then it's just going to be a part of your work with the individual. And career development, it may be a workshop, again, small group. You may have, however, a whole curriculum where you're working with an individual on this area. Where you may see or where you may incorporate career development more on the mental health side is if you're working, I think, if you're doing like any type of, again, regular, more psychoed focused or group focused work with individuals to help prepare them for daily life, right? So life skills group, maybe for lower functioning groups of individuals, again, IOP, substance use, you might try to incorporate some career stuff with those groups as you, again, try and help support them in their transition. And I would envision this. I think it would be a good space for it, even if it's not already there. Especially if you are, I've worked with a lot of students who are doing these types of things, these types of psychoed groups where they're just really struggling to come up with things to do. And I think that career stuff would absolutely be a good thing to incorporate. Use of theory. So career theories should ideally guide your career counseling efforts. Remember though, they are complementary and not competing. So with career stuff, you're likely going to come in and identify the client's issue first, and then determine what theory may be most appropriate. There's still going to be a space where you have your personal theoretical orientation. And so you're going to see things in a different way depending on the person. And, because you have that lens, I'm very systemic oriented. And so I often focus on the more systemic things with the person. And I'm very constructivist, very narrative. And so those are the two areas where I often, again, see the issue, because that's the lens through which I kind of see the world. But there are certainly times where if I've got someone who's really struggling with making a decision, I'm going to work with them from a more cognitive standpoint, because they need support making a decision. And that's where their issue lies. And that's a theory that's going to work well with someone who's struggling with that particular issue, if that makes sense. And here's some examples. So the trait and factor theories, and I'll just speak to where and how I use them. So you might use them in career decision making. I typically use them more to increase self-awareness. So these are like your interest inventories, the personality stuff. I use them a lot with adolescents because many are struggling with that self-awareness. Who am I? What do I like to do? And the way they're structured, it really helps make that connection for them to career. So I like to do these things, and this translates into that job. And so it also helps from a psychoed standpoint of helping them make the connection between their life and their future. The developmental theories, again, like I said, this can help you understand the issues relevant to your client. So again, where should your client be developmentally speaking? Or maybe what didn't they get? Right. So why is this issue coming up for this client? Why is this such a struggle for this individual? Maybe because they didn't get that need met when they should have. Learning theories, you might use these to increase learning experiences. So if you've got someone, maybe from a developmental standpoint, who didn't get a lot of career exploration when they should have in their life, maybe because of socioeconomic status, maybe because of, struggling with other things, like I mentioned before, you may fall back on those learning theories and help them create some experiences for themselves to get to know themselves, to build a better understanding of the world of work and of careers. And we might always consider self-efficacy and how it might impact our client. I think that's just an important concept that we see in, not just the career areas, but in all areas. But really in career areas, we talk a lot about self-efficacy and how confident is this person in their ability to do these things. Because a lot of the people that we might work with are not very confident and their ability to make decisions and their ability to navigate careers. And we can certainly help with that. The more narrative theories, these are great with that identity piece. And these are really great with, challenging past narratives about, maybe negative experiences that they've had with jobs, maybe failures that they've had, and helping them reframe and rewrite those stories. And then the psychology of working, I always have to mention this one. This is really good to help your client with advocacy, maybe likely you're going to be helping them with advocacy at the individual level, and then you might be advocating at the systemic level. This is where you can help talk to them about how do you negotiate? How do you set boundaries at work? How do you say, no, I can't take on more tasks? How do you say, these are my needs in this job, right? So those are some things that you can work with a client on to help them do those things. And again, many of the people we work with may struggle with these issues, maybe because they don't know how to do that, or, because of past experiences or past traumas that are impacting their ability to set boundaries and to, maybe be more firm, be more assertive in their career lives. And then the stages of career counseling are going to be very similar to the stages of counseling in general. So the beginning stage is the introduction. This is where we're building rapport, talking about informed consent, helping identify client concerns and goals, gathering background information. The middle stage is where we're going to be identifying strategies likely related to the theories and then implementing them. And then the ending is the conclusion, where we're seeing maybe a plan for the future, and then evaluating our work with that person. And that is all.